Next on Worcester News tonight, a call to action. Molly Bish's family marks 18 years since she's been missing by working to change legislation. Plus, a packed meeting tonight discussing the sudden closing of the Plumley Village Health Services Clinic, which will leave thousands of patients.
Does June 27th, 2000 mean anything to you?
Years since Molly Bish vanished, her family releasing a new video about what investigators have learned since her disappearance. Good evening, I'm Anna Botari. The 6-minute video includes interviews with her family and one of the lead investigators on the case. On this anniversary, her family isn't holding any vigils or events. They're asking people to contact local senators to help change the laws on how missing children cases are handled. Our Chandler Walsh explains.
18 years later, and Heather Bish is still looking for answers about her sister's abduction. 16-year-old Molly Bish was taken from her lifeguard post at Cummins Pond in Warren.
How I miss my sister doesn't change. I often compare it to losing an arm or a limb. You know, you sort of learn how to live without it, but it's still not there. There's still a hole in your heart.
On the anniversary of Molly's abduction, the family is calling for action. A bill now in the state Senate could prevent what happened to Molly from happening to other children.
To ask everyone to call your senator and ask them to support Amendment 908 to protect children.
The bill would require police officers to go through a 2-hour training for missing children cases and would set uniform policies for officers throughout the state to follow.
The sooner that the police can be on the case and that there are set protocols to follow, a better chance of having a child returned unharmed.
Bish says 76% of children abducted by a stranger are killed in the first 3 hours. It's the same amount of time it took before police called the Bish family when Molly was abducted.
When they went to the crime scene, it was a mess. People had already touched the lifeguard kit, disturbed the entire scene. It was chaos.
Molly's remains were found years after her abduction, but her killer is still unknown. Bish is hopeful they're close to answers thanks to recent DNA testing.
We've actually have enough DNA that we're able to say that there's someone out there besides Molly's DNA, and we just need to match it.
Chandler Walsh, Worcester News Tonight.
In the wake of UMass Memorial Healthcare deciding to close the Plumley Village Health Clinic, City Councilor Soraya Rivera holds a standing committee meeting Wednesday night. The request filed by Rivera is asking the city manager to work with the hospital to address the many issues rising with the closing. Our Brittany Schaefer was at the meeting. She joins us now live with more. Brittany?
Anna, the main issue for patients is finding a primary care physician. Rivera says many of the patients don't speak English, and finding a new doctor has been difficult.
This is a loss for us as a city.
In less than 2 weeks, the Plumley Village Health Clinic will close permanently, and for patients like Patricia Price, it hasn't been easy.
I've been seeing my doctor over there more than 20 years, and for me to have to go find somebody new, it's traumatic.
District 4 City Councilor Soraya Rivera held a City Council Standing Committee on Health and Human Services meeting Wednesday night. During the meeting, an employee at the Plumley Village Apartments says many of the doctors recommended by UMass Memorial are not accepting patients.
I probably got maybe, 12 or 15 deep into the doctors and still couldn't find anybody who was accepting.
If that becomes a challenge, what are we doing to address the challenges, and how are we working together collaboratively to make sure that the patients have adequate, equitable care? That's the most important thing.
The sudden closing of the UMass Memorial office will leave 2,000 patients looking for a new primary care physician. The Plumley Clinic Coalition says half of the patients speak little to no English.
The doctors who work there and the whole staff I could understand them, speak to them in their language, and followed up with them. They would make sure that they understood. They'd call them at home.
Price says another big problem is many of the suggested doctors don't have offices in Worcester, and traveling isn't an option for many patients.
I want UMass to put them over at the hospital where they were supposed to go in the first place. Put the team back together and keep them there. That way the patients don't have to scatter and they don't have to stress about finding another physician. I was stressed.
Rivera says the goal of the meeting is to help the patients' transitions go as easy as possible.
What's important that we as a community and we as a city are never afraid to come to the table collectively to try to come up with solutions that's going to better our community, even if they're difficult conversations.
During the meeting, Rivera was taking down questions to ask UMass in the next few days. As for Price, she did find a new doctor through a referral. Brittany Schaefer, Worcester News Tonight.
Thanks, Brittany. A Worcester chiropractor is indicted in connection to an insurance fraud scheme. According to the Massachusetts Attorney General, Dr. Kelly Cow allegedly falsely billed insurance companies for items she did not provide and for services not rendered to patients. 47-year-old Cow is a licensed chiropractor and the owner of Healing Hands on Burncoat Street. According to the AG's office, she's been indicted on several charges, including motor vehicle insurance fraud and larceny over $1,200. She'll be arraigned in Worcester Superior Court at a later date. A Worcester Superior Court judge has denied an injunction filed by the town of Southbridge. The town requested a preliminary injunction to order Casella to continue curbside collection through 2027. According to the Telegram, the town says the landfill operator is obligated to provide curbside collection until 2027 under the terms of a 20-year agreement signed in 2007. In a written decision Monday, the judge denied Southbridge's motion without prejudice. The town can renew the motion when potential harm is immediate. A live demonstration at the Department of Fire Services shows how quickly a fire can spread. It also shows a life-saving tool firefighters recommend everyone installs in their homes. Our Rosalind Flaherty explains.
In just 2.5 minutes, this room is at flashover.
That's not survivable.
A mock demonstration at the Department of Fire Services shows the speed of an uncontrolled fire in a mobile sprinkler unit. One room has the benefit of sprinklers, the other does not. Sprinklers pour 13 gallons of water per minute on the fire, containing it in 50 seconds.
Where the fire starts, the sprinkler is designed to keep it there so that the firefighters can get there, put the fire out, rescue the people.
Shane Ray is the president of the National Fire Sprinkler Association. The NFSA donated the mobile unit for Wednesday's demonstration. Ray says sprinklers are typically installed in commercial buildings, but homes are often forgotten. He says more than 80% of people who die in fires die in their home.
In your homes, that's where you're asleep and those things. So in commercial buildings, the codes and standards have evolved over the years that we have adequate exits, the door size. All those regulations that sometimes we think we don't want, they're there for a purpose. And most of them created on the heels of a tragedy.
State Fire Marshal Peter Ostrowski says modern items like furniture are loaded with synthetic materials and can be toxic.
Gives off that dark, black, disorienting, disabling smoke, but it also promotes flame spread.
Ostrowski says demonstrations like this educate people on how important fire sprinklers are.
Sprinklers save lives.
Rosalind Flaherty, Worcester News Tonight.
School is officially out for the summer, but educators say the learning shouldn't stop over vacation months. It's why Worcester Public School Committee member John Monfredo is giving free books to children across the city. The former principal kicked off the 13th annual book drive in March. The drive has collected more than 600,000 books over the years. Monfredo says he wants to spread the joy of reading to children who may have difficulty getting books.
As a school committee person, I see so many students, especially when you have many students coming from other countries, not having any resources in their homes. So it's my way of saying, okay, let's give these books to the children. Let's have them flooded with books in their homes.
Monfredo says this year was a big success with more than 30,000 books collected. A Worcester public school is getting a much-needed renovation thanks to the Massachusetts School Building Authority. The Challenge and Reach Academy in Worcester has been accepted into the MSBA's Accelerated Repair Project for window, roof, and boiler replacement at the school. The work will cost a total of $5 million in repairs. MSBA will fund $4 million, and the City of Worcester will contribute the remaining $1 million. The Challenge and Reach Academy is the 25th Worcester public school that has been invited into the Accelerated Repair Project funding of the MSBA since 2012. South High Replacement School and the Daugherty Memorial High School are also in line for total replacement. Providing a safe and structured environment, it's the goal of U Inc.'s group home for young men in central Massachusetts. The U Inc. George Bernardin Oxford House is a long-term intensive group home for adolescent boys who have experienced significant adverse life events impacting their function at home, school, and in the community. Wednesday, the Worcester Railers announced a $100,000 pledge over the next 3 years to support their psychiatric department.
They presented, what they were looking to do over the next few years with the expansion, and we couldn't think of a better, more fitting partner than U Inc.
A lot of agencies struggle with having in-house psychiatry resources, and so we are looking to invest in expanding that capability and really offering more services, not only to the clients that we serve at U Inc., but also the broader community.
U Inc. says their psychiatric department is a critical foundation to many of its most intensive services that support mental health for children and adolescents. The Fairlawn Foundation awarding almost $360,000 in grants to address mental health needs in Worcester. The fund is focused on innovative projects such as closing gaps in service and increasing the supply of qualified and culturally competent mental health professionals. 6 different organizations were awarded, including U Inc. State health officials announcing they found samples of the West Nile virus in mosquitoes for the first time this year. The Massachusetts Department of Public Health says samples were found in Norfolk County, but the entire state should now take notice when going outside. Our Cam Jandro has more.
The state of Massachusetts announces their first positive samples of West Nile virus in mosquitoes. The mosquitoes were found in Weymouth, but health experts here in central Massachusetts want residents to prepare.
Avoiding being out dawn and dusk, so that's 2. Dressing correctly with long sleeves and potentially with treated clothing. DEET, and drain standing water.
Dr. Michael Hirsch is medical director for Worcester's Division of Public Health. He says people over the age of 50 have a higher risk, as well as those with weaker immune systems.
So patients with HIV or patients who are on steroids for other reasons, patients that are on chemotherapy for cancer.
Last year, Massachusetts saw 6 human cases of West Nile virus. Symptoms can include high fever, double vision, and in rare cases, severe illness. Parents like Orlando Rodriguez say they take extra precautions with summer here.
That is definitely something that you think about and you worry about to make sure it doesn't affect you or your children. We make sure he has the spray and everything that he needs to keep them away. Same for myself.
Dr. Hirsch says the unusual winter weather has made it difficult to determine how bad mosquitoes could be in 2018.
We didn't really have a bad stretch of freezing kind of snow conditions until March, and so it's really unpredictable whether the damage was already done as far as egg laying goes, and so we may have a bad summer with mosquitoes.
Cam Jandro, Worcester News Tonight.